Lisa.
Lisa with Numerica.
Oh, hi. Okay. Welcome.
With Nan. And this is Joyce with 211.
Okay,
Good morning, this is Sherry. This is Sherry with Snow White with AmeriGroup. Hi, everybody.
Hello, Sherry.
Good morning, this is Bevan Briggs. I'm with WSU Tri-Cities College of Nursing.
Hello, Bevan. Welcome.
Good morning, this is Ben Betcoon with the Yakima Valley Farm Workers Clinic.
Welcome, Ben. Glad you could join.
This is Cindy Gobler with Sundown Inn Ranch.
Cindy, welcome.
Good morning. This is Washington.
Okay, let's have the ladies go first here on this one.
Kendra Palomares with Catholic Charities.
Hello, Kendra.
Kelly.
Good morning. This is Barbara Mead from.
Okay.
Go ahead, Barbara.
Hi, this is Barbara Mead from Lourdes.
Hello, Barbara.
Joel Chavez, CHPW.
Hello.
Kelly Pease, Tri-State Memorial Hospital.
Okay. Hello, Kelly.
Hi, it's Rhonda in Yakima.
And what was your name?
Rhonda.
Rhonda, of all people.
And this is Dan Ferguson, the Center of Excellence Health.
Hi, Laura Johnson from United Healthcare listening in today.
Is it Laura?
Correct.
Okay, thank you.
Penny Bell with Ideal Balance.
Who's there? Who was it?
Penny Bell with Ideal Balance.
Jenny.
And Matthew Kimple.
And Matt. And who are you with, Matt?
From Lutheran Community Services.
Okay, welcome.
Kirk Williamson, Benton Franklin Community Health Alliance.
Hello, Kirk.
Jill Whitman from Chaz Lewiston and Moscow Clinic.
Hello, Jill. Anybody else who hasn't introduced herself or himself?
Carrie Colzon from Kennewick Fire Department.
Hello, Carrie. Good to meet you.
Hi, this is Deborah from CADLEC, Population Health Coordinator.
Deborah, what's your organization again?
CADLEC.
Catalyst, okay.
And this is Victoria Bryan with Ideal Option.
Okay, Victoria. Cute.
Jack Davies, Northwest Rural Health Network.
Greetings from 5 Mile Jack.
It's a beautiful day on 5 Mile.
Yes, it is. Yeah. Well, shall we get started? Welcome, everybody. My name is Patrick Jones. I'm sitting in my home office in North Spokane, a place called 5 Mile, where Jack Davies and I both live. And we have a very sunny but windy day. I think we broke records yesterday for the amount of rain in a 24-hour period. So I imagine a few of you folks got some of that wet stuff as well. I took a little gander at the weather forecast for Yakima, Tri-Cities, Walla Walla for Memorial Day, and it looks like you're going to have a wonderful Memorial Day weather-wise. In fact, it looks like you're in the low 80s or high 70s. And in fact, Richland looked at mid 80s for the Monday forecast. So big change from today, and won't be quite as warm up here in the northerly climes of the state, but we're looking forward to hopefully a relaxing Memorial Day. And we don't have the option of time to go around the room and ask, and I'll pose the question what you're planning on doing, but I hope that you all have something relaxing, rewarding, family-friendly, and fun. So as you see from today's agenda on the screen, we're going to have largely a panel discussion with experts in certain industries and exploring the backdrop of the economic recovery in the ACH counties. We've spent a lot of time talking about, and I think we all know, many of us work in that area of the public health implications of the shutdowns, and this is an attempt to provide, if you will, some of the upstream determinants of health for what is and has been going on in the shutdown. And to that end, we've invited Greg Lane, who is, if you saw the announcement that came through from Chelsea, is the person in Olympia who runs the statewide Building Industry Association, BIAW, I think it is, Greg. We have somebody who's been with us for a long time, Megan DeBolt, who'll be talking about what has been happening in Walla Walla County, in particular, what's been happening in the I want to say shutdown, but to some degree it was in the episodes with Tyson. We're going to ask Dr. Larry Yeka to talk about his spin from the public health perspective when counties could move in our region, could move from phase 1 to phase 2, and how he sees that happening in the next few weeks. We've asked Ramon from United Farm Workers to talk about his perspective on basically agricultural work, field work, production work. As we know, there's been some challenges there, as well as in the processing plants. To get a little bigger picture, we've asked Allison Polson, a colleague of mine here in Spokane, who heads up the equivalent of the GCACH in the Northeast Washington area, but is also on the state organization that is advising the governor and the Department of Health on the reopening. And then last but not least, we've asked John Roach, who is very active in the Tri-Cities in a variety of contexts. If you read his little bio, to give a perspective from the consumer point of view. So we're going to try to get all this done, plus a couple of brief presentations to start in a couple hours. And so before I start with that, are there any questions that you all have? Are we good with that agenda? Anybody have some quick announcements that you might want to put out there? Carol, do you have any quick announcements?
I do not, Patrick. Thank you for asking.
Okay.
And welcome, everybody.
Okay, then let us get going with a little brief presentation by me. And I'll take over the screen here real quickly. And you'll see what I'm going to try to show you. Okay, can you all see my screen with the presentation? It's black now, but will be hopefully red. Everybody see it? Okay, so I've been spending quite a bit of time in my work at the Institute for Public Policy and Economics to look at sort of the unemployment, the very gloomy unemployment numbers that we've been seeing, or job loss numbers that we've been seeing due to the coronavirus and the state policies, and try to get a track of, in particular, where those job losses are centered, or where there's been a big emphasis on the job loss. So this is a look at not 9 of the counties, so my apologies to 5 counties here, but it's a little more difficult to do that for the smaller counties. So I've done it for Yakima, Benton, Franklin, and Walla Walla, and see what you think about all this. Okay. So This is looking at a very short time frame, as you can see with the middle bullet, starting with the middle of March when the executive orders came out, and basically pushing it forward 7 weeks. And as I mentioned, I'm looking at 4 counties, which, by the way, amount to about 85% of the population in the ACH. So as mentioned, I'm going to look at this on an industry by industry basis. The data source is something called the Quarterly Census of Employment and Wages. We're looking at annual data for 2018. Don't have the 2019 numbers complete yet. And I'll be looking at, yes?
Patrick, we lost your presentation.
Uh-oh. How do we do that?
Now we see your, I don't know. Now we still see your screen though. We see your, it looks like your inbox.
Oh no. Well, shall we try again?
Is your presentation still up on your screen that you see?
Absolutely.
Oh,
Absolutely.
now we're viewing Larry's screen. Oops, I wonder how that happened. Hang on, let me fix it.
Well, let me go.
I can't see Patrick's screen there.
Now you can see Patrick's screen?
And Chelsea, can you see my screen?
I cannot.
No. No.
Oh boy.
So let me take it back. It's okay. Let me take it back and then I'll send it back over to you. How about that?
Okay.
Okay, now I'm
okay. Can I try now?
Your screen's up on mine.
Is it? Can everyone see Patrick's screen?
No.
No, we just see the agenda.
Oh,
There we
go.
go.
Now.
Yeah.
Okay.
Try again? Okay.
Try again.
So,
We can see it. Thanks, Patrick.
okay, let's try again. Technology. Okay, so we're going to be looking at what we call sectors, or which is the largest aggregation of industries. Each sector has about 5 to 6 industries, which I used over the course of the last few weeks to make an estimate about the job losses. And most of the job losses are folks that are part of the unemployment insurance system, which are then part of this QCEW data set. But I think, as we all know, due to the CARES Act, that for the first time, sole proprietors and independent contractors will be receiving unemployment benefits as well. So these numbers that you're seeing from me will actually go up. I don't know if you saw the news yesterday from Susie Levine from Employment Security, but these numbers could go up a lot. So I'm going to just give you some backdrop and show you sort of where jobs are located in each of the 4 counties. And I just want to point out that there's about 116,000 people employed in Yakima in 2018. 2019 will be about the same. That does not include sole proprietors. So let's go quickly over to Yakima and see what we find. And can I, with screen controls, okay. So here's the look at the Yakima economy in red by the 5 biggest sectors, and no surprise, 28% or almost 30% of the economy is centered in. Second largest sector is government. The 3rd largest sector are hospitals and clinics and social assistance programs. The 4th largest sector is retail, and the 5th largest sector is manufacturing. And the bars to the right in green are the Washington state counterparts, and you can see that there's a big difference in what the state is facing. For example, 3.2% of the workforce in ag versus something that's 9 times higher in Yakima County. So that's Yakima. And let's go to the Tri-Cities. The Tri-Cities has a slightly larger workforce. As you can see at the bottom there, 124,000 in 2018. We think that's going to be when the data come in. Between that number and 130,000, so let's put it at 127,500. And again, you're going to see here shortly that the economy in the Tri-Cities is different from the state of Washington, again due to agriculture, but in this case also Hanford. So here we go, looking at Benton Franklin, and let's see what we show here. Unlike Yakima, the largest sector in Benton Franklin is government. That's the second largest sector in Yakima. The second largest sector in Benton Franklin is healthcare and social assistance. Agriculture is important, but not nearly as important. You see that's 10.5% versus 27% in the Tri-Cities. Retail trade is slightly larger. This is 10.6 versus about 9% in Yakima. And then finally, there's this unique sector called waste services. And I think we know what that refers to. So again, these are considerably different than the state of Washington. Waste services being in the state about 5%, twice as high in the state, in the two counties. Okay, moving on, let's look at then Walla Walla. So Walla Walla is also quite a bit different in its economy from the state of Washington, again due to agriculture, but significantly it's got a large manufacturing sector and a government sector relative to the size of the economy. You can see it's a small place, 28,000 versus 130,000 folks employed in 2018 in the Tri-Cities and about 115,000 employed in Yakima. And it looks like for 2019, and who knows what 2020 is going to look like, the numbers were about the same. So where do people work in Walla Walla? Real quickly, let's take a peek at that. That will come up here. Okay, here we go. The largest sector is government, and this has some significant implications for job loss in that county. That's a very high percentage, 20% of the workforce is in either state, local, or federal, and there's quite a bit of federal and state employment in Walla Walla, for those of you who are somewhat familiar with it. Secondly, Walla Walla has the highest percentage of its workforce among the 4 big counties in healthcare, 15%. You saw that earlier at 10 to 12% in the other counties. So this has some implications which kind of surprised me though in the downturn. Significantly, its manufacturing share is about twice as high as you see in the other big regions at 14%. Ag is considerable, but bigger than as a share in the Tri-Cities, but about half the size of the share in Yakima County. And then retail rounds out the top 5, but actually retail is lower than as a share of economic activity than any of the other counties. So with that as the backdrop then, where have the losses come from so far? Now, this is a couple of weeks old, or yeah, 1 week old apparently. So I'm going to start out with Benton Franklin, and this is pretty accurate right now. This is looking at not my estimates, but my estimates that have been updated by what we call the initial claims for unemployment. And the state tracks that every Thursday. There'll be a release during our meeting today from the governor's office, and then I get a release from the economists who feed this information to me on a county by county basis. And surprisingly for me, well, not too surprisingly, but unique to Benton and Franklin, the industry with the largest number of losses has been construction. And we're going to hear from Greg, hopefully, that this is going to be reversing shortly. but that's a unique result. We don't see construction as the #1 job loss sector in too many other counties. The #2 sector that's lost the most is, no surprise, the hospitality trade, accommodation, and food services. You'll see this in the other counties. A surprise to me for almost every county that I have done this for is the job losses that have occurred in healthcare and the job losses that have occurred in the social assistance ranks, which is usually youth care or elder care. So that is a large number that, again, I think, like construction, might be reversed sooner rather than later. We'll see. The 4th largest sector that has been hit, no surprise, I think, to anybody on the line, is retail trade. Most retail has been shut down as non-essential unless you're a big box store or unless you're a grocery store. And then it drops off considerably, the job losses after that. Manufacturing at #5. Waste services, even though it's big, there have been cutbacks. And then other services, which is a real grab bag of basically our service economy, personal service economy. Educational services, which are private schools. That does not include, let's say, WSU, CBC, or Yakima Valley College or Walla Walla Community College, but the private colleges. A sector that's been hit very hard, it's a small sector, is arts, entertainment, and recreation, with an emphasis on recreation. A lot of gyms are part of that. And then finally, professional and technical services. So all this is a total for just the 10 sectors of about 20,500 jobs. And you saw that for Benton Franklin, we were looking at anywhere from 125 to 130,000 jobs in 2018. I think the total, which I'm not showing here, of initial claims for the first 7 weeks is close to 23,000 jobs lost. Unprecedented. Okay, now Yakima, a very unique situation there where healthcare and social assistance, that sector has been by far and away the hardest hit. Yakima, you're the only county that I track, and we track about 8 counties where this has been the case. So I don't know to what degree that is that is commingled with the difficulties that Astria's had, or if it's just a simple result of a lot of clinics being closed due to the inaccessibility to the hospitals for elective care, and the drop off in personal services to the elderly and to youth. That's a big number, close to 3,900 jobs claimed by the healthcare and social assistance, followed by retail trade, no surprise there, followed by accommodation and food services, no surprise there. Something that did surprise me is just the number of job losses in production agriculture. So you can forget the forestry, fishing, and hunting on that sector and just consider that agriculture. And that, unlike the Tri-Cities, construction hasn't been as hard hit in Yakima. And then followed by manufacturing, and then some of the same sectors that you saw in the Tri-Cities are part of the top 10 in Yakima. So the total here for the 10 sectors is 18,000, and you saw that the total employed in 2018 was about 114, 115, I believe. So a pretty hefty number, but actually a bit of a lower number than you see in the Tri-Cities. And I think those in Yakima know that you have had many industries deemed essential, and they really haven't shut down as much as in other places. I'll just tell you, in Spokane, the percentage of the unemployed, or the percentage of job losses, is much higher than we're seeing in any of these counties that I'm showing you this morning. And then finally, Walla Walla. As you can see here, it's a much smaller community, a much smaller economy. The 10 sector total of those with the highest job losses amounts to 3,400, which is, I wouldn't say a drop in the bucket, but compared to the other counties, but it's very meaningful to those in the county, obviously. And due to, I think, the growth of tourism in Walla Walla over the years, the number one sector that's been hit is hospitality, followed by healthcare, followed by retail, followed by manufacturing, followed by construction. Walla Walla, just by the nature of its economic structure, nature of its job distribution, actually has the lowest number of job losses as a percentage of the total economy of any county that we track. And I think a good part of that can be laid at the feet of a very high concentration in government employment. So there you have it. There's Walla Walla, there's Yakima, and there's the Tri-Cities, with somewhat different results. So adding it all together, just for these 4 counties, the number of job losses in the week ending May 2 from the middle of March has been close to 55,000 jobs. And comparing that to a denominator of the number of people employed in those 4 counties in 2018, that's 20%. So that's those are numbers, again, that are just, I think we all know, that are completely unprecedented. I will put a little caveat in here. There's some overlap between some of the reports. So we've been advised by the labor economists that these counts might be a little high. But then, as I mentioned at the start of my presentation here, they're going to go way up once the sole proprietors and the gig economy or the independent contractors get counted. I just also want to point out that there have been a few industries like the big box stores and grocery stores that have hired. And we just got the news today in Spokane that Amazon is hiring 2,000 workers in the next month in Spokane. So if you are fortunate enough to have a logistics operation, which I think Yakima does, I didn't check this out, that's probably been a net job gain as well. I just want to point out that this is not unique. This experience that we're having in the Greater Columbia ACH. Cornell came out at the sort of the start, this would have been late March of the pandemic, and said, we think about 23% of the labor force is at risk. And then this has actually changed in the meantime. An unemployment rate of Q2 nationally by the St. Louis Federal Reserve Bank came out at close to 1/3. We're not going to see anything like that, but we are going to see probably something in the, my guess for second quarter, in the 20% range. So I just want to point out that just at a technical note that these are looking at jobs that are located in the 4 counties and not residents. And so we can't make the comparison here between unemployment rates and what I'm showing you, because unemployment rates are based on residents. And I also want to point out, I think, something very significant, that if we had done this on the basis of payroll, the results wouldn't have been quite as dire, because as I think we've seen, most of the losses, not all, but a good percentage of the losses are in low wage industries, in particular the hospitality industry, in particular the retail industry, and for healthcare and social services, or in the social services part of that. So here's my hope that certain sectors, those that have been, quote, really badly hit, construction, healthcare, manufacturing, will over the next 2 months, maybe 3 months now, shed the losses. And that's what I'd like to hear from some of the panelists today. So with that, I'll just stop and see if there's any quick questions.
Patrick, this is Rhonda.
Yeah, Rhonda.
So, you know, there have been so many thousands of fraudulent claims through employment security. I'm wondering if you have any information about whether those affected any particular sector, and whether, whether the, what do they call them, the imposters, would have had any impact on any of these numbers, and if they really went after any particular sector, or if you have any information on that.
Do not. After I did this, I started changing some of the presentations I'm doing, and there is a line in the data sets that I get that's called sector not disclosed, and it's now become the second or third largest line in each of these reports. And my guess would be that some of those fraudulent claims are sort of lumped into that one. So hard to tell just where they're coming from, but we will know in time. I have to say, since I know a couple of the labor economists working for employment security, that they are just swimming in work. So it's going to be a while before we have those insights. So any other quick questions? Were any surprises to what you've seen here, those of you in the 4 counties? Okay, if not, then we'll hopefully revisit some of these as we talk to our panelists. So Chelsea, why don't you take over the screen again, and let's put Wes's up. Wes, are you there?
Oh, you might be on mute.
Wes?
Oh, how about now?
Can somebody get
Can you
Wes?
hear me now?
Yes.
Yes, Wes.
Okay. So what are you seeing on your screen?
Your presentation.
Okay, great. I just wanted to confirm that. Okay, so today we're going to talk about a few things. First of all, we're going to review some of the numbers around the pandemic. Because of a broad global response to the pandemic, there's a number of organizations, including academic institutions, that have put together some really remarkable visualizations and mapping tools to show the spread of the COVID-19 virus, both in terms of case rates, death rates, hospitalizations. There's just a lot of great tools that are available. So please stand by for some more data. I'll give you a trigger warning here that some of these numbers are rather dreary, but it's important to understand where we are in terms of the progression of the disease. We'll also be briefly reviewing the phases for resuming normal activities in Washington State. And I hope I don't steal anybody else's thunder if they intended to talk about that. So first off, we'll take a look at the World Health Organization, which monitors the spread of the disease. This is one of their visualization tools. And it's important to note here that on Tuesday of this week, there were 106,000 new cases worldwide to WHO. And this is the most in a single day since the outbreak began. And it's important to know that worldwide, we're approaching around 5 million cases, which is another really important benchmark to show the spread of the disease. And I will tell you that the number of cases is likely much higher than that, simply because of not a widespread distribution of testing in some countries, and the asymptomatic or low symptomatic nature of the disease in some individuals. It's difficult to actually track how many individuals have this condition, but needless to say, it's in the millions. The next chart we're looking at here comes from The Guardian, which is an online news publication. They track the case rate by country. This is for the United States. Right now, far and away, we have the most cases reported anywhere in the world. In fact, it's probably 4 to 5 times more than the next country. So this is what the distribution looks like. And while the trend is proceeding downward, the pandemic is still highly active. Some countries like Italy and Spain have a curve that looks more like a bell-shaped curve. Ours is still sloping, but the cases are still relatively high. Some other countries internationally that are worth thinking about, if you track this, are Russia, Brazil, and India. They also have high cases as well as the United Kingdom. So this particular mapping tool is what's called an ensemble forecast model. And I won't go into too much detail about that, but you can see on the right side there are a number of lines that are coming off that vertical line that says today. And what those are predictive models that come from around 20 different organizations to understand where the pandemic is going. And this is for people who are into statistics. This is at a 50% confidence interval. So what's being predicted as a model average from this tool is that by June, we should expect around 113,000 cases nationally in this country. FEMA also projects by the beginning of June about 3,000 deaths per day in this country, and that's significant. And as a basis of comparison, there were something between 1,800 and 1,900 people that died in all of Hurricane Katrina. So there are quite a few individuals who are still falling ill because of this disease.
Hey, I have a question about that, Wes. Can we ask now or later?
You can ask now.
Okay, so I'm curious about the numbers because I know that some of these diagnoses are also because they have other diseases, but that's being put that they're passing from the actual disease, which to me doesn't seem correct. What's your thoughts on that?
You know, to be honest with you, is this Sherry?
Yes, of course.
Sherry, why don't you hold off on that question until we get into the panel discussion with the public health experts who can probably answer that better than I can?
Will do.
Okay, thank you. So moving on, these next two graphs come from the Washington State Department of Health, which also has its own mapping tool, and they've done a marvelous job at mapping out the cases and the death counts across the state. Again, here we see a trend that's proceeding downward, but it's important to understand that Washington State is also highly active. Going back to this map, I should mention that the prediction of cases and deaths going forward with these predictive models are correlate to the number of precautionary interventions or measures that are put into place, such as physical distancing, personal PPE, and other things. So the models predict that the more of these precautionary measures that are put into place, the lower the projected case rate and death rate is. Again, getting back to the DOH data, we can see that these numbers are trending down. However, there's still a lot of active infections and cases going on. So this information comes from analysis that the GCACH did. This was taking county level data and population health numbers from census.gov that have been extrapolated to 2020. With that data, we calculated the cumulative case rate in that graph on the upper left and the cumulative death rate. As you can see there, the GCACH's cumulative case rate and cumulative death rate are higher than the statewide average, which are those two vertical bars on the right. And we're higher than any other ACH with the exception of Healthier Here's death rate. The bottom right graph points to the fact that that blue line that's proceeding up, and this is the cumulative case buildup, trailed the state overall, meaning that the infection started here a little bit later, but now it's exceeding the state cumulative rate. I know this is a lot of information. This is another analysis based on that same Department of Health data. We've broken this out by county. The GCACH counties are in red. Again, this is confirmed case rate per 10,000 on the upper chart. As you can see here, Yakima, in terms of the cases, far and away is above any other county. In fact, its case rate, cumulated case rate, as of May 5th is the highest on the West Coast. It's also important to understand that Yakima has the highest percentage of Hispanics, and statewide, no other race or ethnicity has had a higher incidence of COVID infections than the Hispanic population. When you do the analysis for the death rate, Yakima comes more into line with the other counties, but it still has the highest death rate per 1,000 of any county in Washington. So let's talk a little bit about the phases leading to the restart of Washington's economy. This comes from kind of a summarization of what Governor Inslee has put out over the last week or two. In phase one, which is the phase that at least counties are in, some outdoor recreation is allowed, but the state ban on large gatherings is in place. Only certain businesses have been allowed to restart, including construction, landscaping, automobile sales, and curbside pickup. We'll learn a little bit more about what's going on with the construction industry today. As well, all elective medical procedures are to resume, including medical or dental practices, who can resume based on their own assessment of readiness and the community's activities to curtail the COVID pandemic. It's important to think about that half of the primary care practices in America are small businesses, which means they are battling the virus on the front lines, but they're potentially going out of business. The reason for that is that fewer than 20% of their usual visits are now in person. The rest have either been through telehealth or canceled altogether, as people have been somewhat frightened to go in to see their provider for routine or elective types of care. This is having a significant impact on practice revenue. In particular, smaller independent healthcare practices face an even steeper uphill battle without the financial backing of a health system or a hospital. And a lot of people believe, or some individuals who are doing predictive forecasts believe, that many of these may not survive the pandemic. In fact, one estimate is that up to 60,000 primary care practices nationwide may close or significantly scale back by June. And this is something that should be a real cause for concern. In phase two, outdoor recreation of 5 or less are permitted, along with in-store purchase of retailers. With some restrictions, real estate transactions, hair salon, barbers are allowed to resume their operations. Restaurants can reopen provided they can accommodate half of their capacity with tables that seat no more than 5 people. Going on to a map, we can see here that in the GCACH, Whitman, Garfield, Columbia, and Asotin are now yellow, which means that they are in phase 2. So they are about to resume, if they haven't resumed, some of those activities that we just talked about. I went on to a call for Southeast Washington. Jack, I think, is on the line here. And during that call, they talked about how businesses are preparing to restart, which is very hopeful. The 22 counties in the state are eligible now for phase 2, and combined these counties represent about 30% of the state population. Under previously announced guidelines, most counties are expected to move to phase 2 as of June 1, as long as they meet certain benchmarks outlined by state health officials. We'll talk about those in just a second. In fact, I'll go to those right now. And the criteria for advancing to phase 2 includes a vote by the county's Board of Health, a letter from hospitals confirming that they have adequate bed capacity, an affirmative vote by local county commissioners, adequate testing to provide information about county residents, ability to implement contact tracing in the county, ability to isolate and quarantine COVID-19 patients, and ability to perform outbreak investigations. Counties without variants are expected to be in each phase for no less than 3 weeks. Excuse me. Without the variants, at the end of that 3-week period, there will be an assessment about whether or not a county is ready to move forward into the next phase. Excuse me. So these are some of the other phases. Each phase relaxes restrictions even further. The final phase is phase 4. Where public interactions resume with physical distancing, gatherings of more than 50 people are allowed. Health clubs, concerts, and large sporting events are permitted to resume. Excuse me. So the final slide that I have kind of looks at the future of pandemics. I have some training in microbiology, so I find this really fascinating. You know, today and going forward, we'll all be thinking about when and how things will get back to normal. But it might be useful to use this particular crisis as a way to think about what normal actually means. The more closely we look at what's going on, the more it appears that we've been living in a way that makes future pandemics actually more likely. About 3/4 of the pathogens and violent diseases that affect human beings today actually come from animals. These are known as zoonotic infections. And in the case of the COVID-19 infection, it likely originated from a bat in what's called a wet market or live animal markets in China, and not from a genetically engineered laboratory or genetically engineered in some laboratory. Early on, the genome for the virus was revealed, and there's scientifically really little evidence to show that it was laboratory driven. But as well, human encroachment into wild ecosystems can lead to pandemics. For example, the Nipah virus is highly virulent in humans and was spread in Malaysia and Singapore because of the expansion of farmers into wild habitats. In this case, bats infected farm pigs in encroached areas which infected humans, leading to a high death rate. So as human civilization expands, building roads, clearing farmland, constructing factories, opening mines, we're bringing wild animals and the diseases they carry to closer to us, which increases the probability of additional pandemics. And there are other paths for pathogens as well. As people around the world get richer, they tend to eat more meat. Around 80 billion land animals worldwide are slaughtered each year, and most of this livestock is factory farmed. About 99% of animals that's used for human consumption comes from factory farms in America. And that entails crowding thousands of animals into conditions that are almost designed to incubate viruses. These farms also are ground zero for new antibiotic-resistant bacteria, which is another path towards widespread human infections. Most of the antibiotics produced in this country don't go to humans. They actually go to factory farms to increase animal productivity and weight at slaughter. Again, this is a perfect habitat for creating drug-resistant organisms that pass on to humans. And around 3 million Americans are sickened each year by these drug-resistant bacteria, and about 35,000 die each year from that, according to the CDC. And then there's climate change. Scientific American magazine reported that warmer weather and more variable conditions brought by climate change are making it easier to transmit diseases such as malaria, dengue, yellow fever, Zika, West Nile, Lyme disease, and more in many parts of the world. As ecosystems change and natural habitat gives way to human development, long dormant diseases can emerge to which we have no immunity. So all is not lost, though. There's a lot we can do to reverse these trends, including policies into place that address some of these issues. We can also support better funding for public health, both nationally and locally, and support widespread education about good public health that is culturally competent. As well, international cooperation between countries will help organize a widespread systematic response and stem the flow of future pandemics before they spread like the current one. And I will stop there. Does anybody have any questions?
Well, thank you, Sherry, for your comment. Any quick comments or questions of Wes before we shove on? Just take one. We're a little behind at this point.
We did have a question in the chat. What happens, and this might need to be posted later, but it says, what happens if a county votes to open, but after opening, lots of cases pop up?
I think I'm going to let our public health officials address that in the course of their panel discussion, if that's okay. Any questions about Wes's info? That was very well done, Wes. Thank you for the careful research. Let's hope we see a steep bell curve slope for the U.S. and the state of Washington real soon. Okay, it's my pleasure now to just introduce Greg Lane. Greg will take a few minutes to basically talk about how the construction industry was able to work with the governor, the public health officials, perhaps the legislature, I don't know, to make the case that its industry did not pose significant health risks in reopening. And we thought this might be an interesting case study for other sectors that on the cusp of reopening, and just what BAW did to get this release, which I think we know is now in those counties with phase 2 is complete. Construction is completely open. So, Greg, the floor is yours.
Great, thank you, Dr. Jones. I appreciate that. Good morning, everybody. Really pleased to be with you to talk about this today. I will try and make my comments fairly brief. Wes covered some of what I was going to talk about as well, just in terms of the phasing, so we'll have an understanding of that. But I'll focus mostly on just kind of what our industry in working with the governor's office, because it really did become a model that is being replicated now for other industries as they put together the guidelines around the restart of manufacturing, retail, all the other different industries. So I'll take you back first just to kind of review the history a little. When the governor was in the process of trying to decide whether to institute a stay-at-home order, and if you recall back then, we actually, even though we were pretty quick out of the gate in responding to the virus, being one of the first states to have cases, and our governor acting very aggressively and proactively, which we were all very supportive of, was reluctant, I think, to institute a stay-at-home order right out of the gate, and we actually were one of the later states to actually do a stay-at-home order. We had a lot of conversations from folks in our industry with the governor's office leading up to the stay-at-home order actually being instituted, and to be honest, our expectation was that construction would be deemed essential, both residential and commercial, when the stay-at-home order came into place. And we were a little surprised, to be honest, because at the time we were only the second state out of, I think there were 35 at the time that had stay-at-home orders. We were the only second state, and the only state in Western United States that the construction was not deemed essential and could continue through the stay-at-home order. BIW represents the residential construction industry. We have about 8,000 members statewide, all associated with residential construction, everything from general contractors to electrical contractors, subcontractors, plumbers, everything around residential construction, insurance agents, anything to do with constructing homes and condos and anything that's housing related. We have local associations in your communities as well. I think you're probably familiar with the Tri-City Home Builders Association and the Central Washington Home Builders Association, Yakima. Both of those local associations are one of 14 We have 14 local associations around the state of Washington that then feed up into the state association and BIW. But we had a lot of conversations with the governor's office leading up to the stay-at-home order. I think we fair to say we were a bit surprised that we weren't included as an essential workforce. But to the governor's credit, we, in follow-up conversations after the stay-at-home order went into place, and after he heard from a number of legislators and local officials about trying to come up with a plan to get construction restarted, he created a working group, a small working group of 6 representatives from the industry to sit down with folks from his office, from the Department of Health, Department of Labor and Industries, and try and come up with a list of safety guidelines that could be applied to construction to ensure that employees, their families, and the public could be safe and safely return to working on job sites again. BIW was one of the 6 organizations that had representatives at the working group. I actually was the representative from BIW, so we're involved in those conversations. We started meeting about a week after the stay-at-home order went into place, and the other folks around the table were a representative from the Association of General Contractors, AGC, which represents more the commercial side of the construction industry, a representative from the Association of Washington Business, who also has a number of both residential and commercial construction businesses that are members of that organization. And then on the other side, 3 representatives from labor groups, the construction trades industry, the Carpenters Association, and the operational engineers. And we sat down, and I think very quickly out of the gate, one of the probably surprised a bit both the governor's office as well as labor was the commitment from the industry side to a number of different safety protocols, and really with us coming to the table with the attitude that we really, our top priority was keeping our employees and the public safe. I think there was, I don't know if misinterpretation or misperception of our industries, but we have great interest among our membership of keeping their employees safe on the job site. All of our members are actively involved in their own communities. They didn't want to do anything that was going to contribute to the spread of the disease among their communities. And so once it was very well understood around the table that the highest priority was coming up with protocols that would ensure everyone on job sites was protected, we then could really focus down onto what those requirements should be. The other thing that we focused on very quickly was, instead of talking about types of projects, whether it's commercial or residential, we really wanted to focus on the risk associated with the work activities themselves. And this chart, kind of produced by Labor and Industries after our conversations, kind of gives you an indication of where we headed. We defined very quickly what would be considered kind of negligible or low transmission risk, and then separated out what would be more the medium and high transmission risk. And at that point in time, we were focused on separating between the social distancing requirement of 6 feet. So if an activity could be done on a job site that could maintain social distancing of 6 feet, it was considered negligible or low. But if work required employees to work within 6 feet of each other for any sort of extended period of time, more than maybe 10 minutes and an hour, that would move it into the medium or high transmission risk category. So we made a decision very early on that we would focus on phase 1 of the reopening construction and only allow work that could be negligible or low, and not even get into any work that could be considered medium or high transmission risk. So that was one very clear delineation that we made right from the start, that a phase one would only allow activities that would be negligible or low transmission risk, and that we would put off for discussion into any sort of a phase two or phase three at that time, risk associated, or activities that would be associated more with the medium and high transmission risk. So the list of requirements that we came up with were pretty extensive, and if any of you have seen the more detailed list that the governor released when he authorized construction for phase one to start on April 24th, you can see more detail. But the things that we developed and came up with were that every job site had to have a specific COVID-related site safety plan that identified all the activities and the risk associated with them in phase one, and the plans in place that would be put on a job site to mitigate those and protect employees. This included everything from designating a site supervisor that would oversee all of those safety requirements and make sure that employees on the site were following the requirements, that they were maintaining social distancing, that they were getting the necessary initial training about all the safety protocols and the ongoing weekly training that was required in the document, that employees were always maintaining that 6-foot social distancing barrier, that they were wearing the proper PPE, and in the requirements they were required to wear eye protection, they were required to wear facial coverings at all times, and they were required to wear gloves at that point at all times, and that's altered a bit in phase two. But so they were required to wear those 3 pieces of PPE on the site at all times to protect themselves. The site safety plan had to include protocols for cleaning the site on a regular basis, especially those areas that employees were in quite a bit. When multiple employees, if there were bathrooms on the site, those had to be wiped down on a regular basis. A cleaning schedule had to be established. If tools were shared, they had to have a protocol of wiping those down in between tools being shared from one employee to another. We came up with a screening process where temperatures had to be taken of all employees at the job site, that the questions associated with other symptoms, the screening about other symptoms around COVID came up with. So we came up with this entire list, and then implementing in the site safety plan all the employee health policies around what happens if an employee shows symptoms on the job site, what are the steps that have to be taken there, if an employee confirms that they've been exposed at some other point, or if they've exposed other workers on the site. All of those steps had to be outlined in the site safety plan. So extremely comprehensive list. I think there were 30 total enumerated items in our phase one list. And we came up with those, with that list and our recommendations from the working group, and sent those to the governor on April 14th. And then we had discussions with the Department of Health, and Ellen and I altered those with the governor's office, and then ultimately the governor had the confidence that construction could reopen, and he made the announcement on April 24th that that phase one of construction could start. And again, phase one was limited only to existing construction projects, so new projects couldn't be started, and only activities that were low or negligible risk, so only activities that would accommodate 6-foot social distancing. Our industry on the residential side and on the commercial side as well, but speaking from the residential side, embraced those requirements and did everything we could to educate our members and help them get in compliance to get out on the job site quickly. We knew that as the first industry out of the gate, that we were kind of setting the example, so to speak. And the governor would be evaluating how our industry performed in terms of meeting compliance with those requirements before he would consider opening up other industries, so that we knew that we were kind of laying the groundwork, blazing the trail, if you will, for other industries. And in fact, the process that we went through came a model that the governor has now replicated for discussions with other industries. And if you look at the way that our guidelines were, or our safety requirements were organized, it became a template that has now been repeated for guidelines being issued for other industries who are allowed to restart with phase 1, and the guidelines that are now being instituted for other industries as we prepare for implementing phase 2. Wes went through the counties that have been approved so far for phase 2 to be implemented now, and the counties also that are eligible to apply for phase 2 adoption. The governor has indicated that phase 2, the earliest that he'll do statewide adoption of phase 2 is June 1st. However, I do think in conversations that I've been having with the staff and just kind of listening to the public comments the governor's making, my guess is that phase 2 statewide implementation is going to be delayed a bit. So those counties that have become eligible for phase 2, I know are most of them are preparing, put in application, or have already submitted application, be considered hopefully get to phase 2 a little bit earlier than the rest of the state. In terms of a working group, we have already recommended, and the governor has issued phase 2 guidelines for the construction industry, and those change some from the phase 1 guidelines that we put forth. We've been learning a lot, and the agencies have been learning a lot about disease and the spread of the disease, and so we took those into account as we put our phase 2 requirements in. But we are, as we have been from the start as an industry, fully committed to implementing and complying with the safety requirements to make sure that our job sites are safe and our employees and communities are protected, even as we move into phase 2 adoption as well. Our members were very excited to get back to work, to get back to the job site. I was shocked a bit. I've seen statewide numbers, Dr. Jones, about unemployment for the construction industry, but see the impact specifically in Tri-Cities that we're the leading industry in terms of unemployment claims. I hope and would expect that those numbers are going to come down when that we're back out on the job. During the phase 1 reports that we were getting from our members, is that they were able to get back to about 70% capacity. That will improve as we move back and implement phase 2. Under phase 2, all construction activities will be authorized, and new projects can also start. So that'll also help in the industry in terms of recovery. And I hope that those unemployment numbers will continue to drop as we get into phase 2 and beyond. So that's kind of the process that we went through. As I said, we were really pleased to be able to kind of lead the way and lay the groundwork. And I think as other industries now come online, we've set a pretty good example in the construction industry as to how this can be done the right way and keeping workers safe, keeping the community safe as we head back to economic recovery. Happy to answer any questions or stick around till the end of the panel to address questions as well.
Thank you so much, Greg. That was very illuminating, and I would like to have a panel discussion at the end, but if there are any specific questions just about facts, contents that you just saw on Greg's slides, go ahead and raise your hand and ask away. Anybody have questions of how this worked at the BIAW and actually the entire construction industry in the state? All right. Well, Greg, if you wouldn't mind sticking around, we're then going to now take a turn to looking at public health perspectives. And our first speaker is, as I mentioned at the start of the session, is Megan DeBolt from Walla Walla Public Health. And Megan, you do have a presentation? Okay, very good. And as I think many of you know, Megan's been a busy person the last few weeks, and generally speaking, but in particular with one plant in western Walla Walla County that she's been in the headlines, at least in Spokane with. So Megan, welcome to the panel, and the floor is yours, and we're all ears.
Thank you. Can you hear me? I want to make sure.
We can hear you.
Okay, good. So, yeah, good morning. I'm Megan DeBolt, the Director of Walla Walla County Department of Community Health. And I think Chelsea is driving my presentation. And so I'm going to be talking to you about a pretty controversial topic and something that it's just a really difficult situation that we have with several, Walla Walla is not unique either. Tyson Fresh Meats is not a unique situation. There are several meat processing and food processing, agricultural processing plants throughout the country who have been hit really hard with COVID-19 amongst their team members. And I will say I have, our perspective is purely the public health perspective. So that's there. And I know Dr. Yucca's on the line too. And so I would let him weigh in at any point as well. He's our health officer here for Walla Walla County. So Chelsea, could you go to the next slide, please? It's our timeline really of what we've seen here in Walla Walla County. And so on April 1st, we had the report of our first case who was a team member at Tyson, and from there we did our case investigation, and on April 6th we actually met with Tyson corporate and local plant management to discuss kind of their current cases, because we were not aware at the time of how many cases were in Benton Franklin. I can't remember how many cases there were at that time, but it was more than one. And so we talked to them about, what their mitigation measures were. And at that time, they were kind of just starting to implement mitigation measures. And, between the 6th and over the course of that week, we started to see several more cases come through, both in Walla Walla County and Benton Franklin counties. And I will say that Benton Franklin Health District has been a huge partner in this, as we have tried to manage what we call a multi-county outbreak there at Tyson Fresh Meats. And so on April 13th, myself and Dr. Yucca, and a member of our environmental health team, and our emergency preparedness program coordinator visited Tyson and took a tour to see, what they had in place. And at the time they had some things in place, not a lot. Some people were wearing masks, but it wasn't required yet. There was a lot of hand washing, a lot of sanitizing, but there were some physical barriers in between places on the line for processing, but not everything had been implemented yet. And so over the next couple of days, we created a pretty robust mitigation plan that we created pretty much independently, because there were not clear guidelines from Washington State Department of Labor and Industries, nor from the CDC or Department of Health, anywhere. And nobody had really clear guidelines yet. And so we pretty much had to develop them ourselves with the pretty limited understanding that our team has about food processing and meat processing. The only role we usually play at Tyson is we we licensed their kitchen where they sell food to team members. And so it was a learning curve for us, but we created a pretty robust plan that we had ready to go on April 16th, and then all of a sudden Washington State Labor and Industries released their guidance, and we're like, oh, great, we have something to reinforce our plan. And it was actually the Washington State Department of Labor and Industries, L&I, their guidance was really in line with ours. And so we sent our guidance to Tyson to say, you guys have to put these things in place, and you have to put them in place by April 20th. Which is just a couple of days for them to do it. We sent it on I think April 17th was like a Friday or a Thursday, and we told them they had to have them in place by the next Monday. And so we talked with Tyson several times over that weekend, and they had, to make sure that they were going to be able to be successful on Monday. And then our team went back out that following Tuesday on the 21st to inspect. Or really to monitor. We don't do formal inspections there. That's Washington State Department of Labor and Industries role. But we went back out, and our team saw that they had put in place all of the required mitigation efforts. And so, Chelsea, could you go to the next slide, please? So before we released that guidance, the things that they had that were going well was they did have good sanitizing and cleaning of the facility. Like, they were doing a good job with that. That's kind of part of their natural operation, right? Things that did need improvement were that they needed to increase their employee education. They needed to kind of rethink their symptom screening and case monitoring, and they needed to really do something about physical distancing, social distancing, kind of one and the same. But we were saying that, the main places for transmission of COVID-19 on site were most likely not along the line, like the butcher line, but they were most likely in the harvest room, and in like the common areas, like the hallways, the break room, the cafeteria, the locker room, and bathrooms. And there was just no signage. And so that was part of our requirements. I'm happy to send them. I've actually had several public records requests to date from various different organizations who want more information, and we're happy to share all of it. And it's really in line with what the CDC now recommends. The CDC guidelines didn't come out until like April 24th. And so we were glad that we could help actually inform those guidelines as part of a CDC-led team with Dr. Person and members from Department of Health on releasing an MMWR from the CDC on meat processing plants and kind of success measures that they can put in place. And so, Chelsea, if you could go to the next slide. So once we did our on-site inspection and saw that they had put several things in place, we were going to take a four-prong approach, which we are still going to do, just a little bit different though. So our team was going to go out twice a week to do inspections. We were going to review case investigation reports from both Walla Walla and Benton Franklin counties. We were going to take information if complaints came through Washington State Labor and Industries, and then we were also going to track the epidemiological curve of the daily case count and percentage of infected workers there at Tyson. That's what we had planned to do, and we will still do most of that. But then things like we started to see a lot more cases in between, the 21st and Chelsea, you go to the next slide. And April 24th, or April 23rd, sorry, we sat down with Tyson, and we had seen a pretty steep increase, especially in Benton Franklin counties. And, we were talking to Tyson about it at their corporate and local level, and like, why don't we just test all of your employees? Because something is still going on here. It's already there. COVID-19 is already there, and it's circulating amongst your team members. And what can we do? And that's where originally in our initial conversations with the state, Dr. Scott Lindquist, who's one of our lead epidemiologists for Washington State, said, why don't we could just test everybody? And we were like, oh goodness, that's a really heavy lift. And what does that do? But we didn't initially and we had a lot of pressure from everywhere to just close them for what, 14 days. We would close them for 14 days and we don't have specific guidance and structure for them to reopen. That closure doesn't really tell us much, you know, because they could reopen and then it just start back up again. And so if we were going to do a closure, we wanted to make sure we were doing something, and that Tyson had something that they needed to do, and that we were doing something as well to help monitor. And so Tyson chose to let us move forward with testing all of their employees and to temporarily close the facility. So Chelsea, if you could go to the next slide, please. And so we started testing employees on April 24th. It was like really close the next day. And we had a partnership with Providence St. Mary Medical Center and Tyson staff to test employees, and we did it at 3 different times. We did about 1,200 employees or 1,100 employees the first day, and then we went back the following week to test a few more employees and contractors, and then we went back again because there were several employees and contractors who were already on leave of absence and things like that. And so over that, you know, about 2-week period, we tested 1,345 team members and 19 USDA inspectors. And we can go to the next slide, is an overview of all of our testing. And so for this outbreak testing, which or facility-wide testing, everybody that we tested there at Tyson was asymptomatic. And so that's what's pretty interesting about this, because we know that there's a decent prevalence rate of asymptomatic COVID-19 cases in the community. And we saw that at Tyson as well. And so of the, 1,329 employees that people that we tested there, my numbers are off there just a little bit, but this one's right, 1,329 people that we tested. We had 151 positive test results. 8 of those were in Walla Walla County, 137 in Benton Franklin County, 2 in Yakima, and 4 from Umatilla County. And then we had our, 1,178 or so negative test results. And so we saw that, we were able to identify some additional COVID-19 cases. And what we did there was that, from when they were tested to when we had test results, everyone was, of course, instructed to go home and isolate or quarantine and until they received their test results back. And so Walla Walla County, we had notified all of the positive test results in Walla Walla County. Benton Franklin County Health District notified all of their positive cases, Yakima theirs, and Umatilla County theirs, and then Tyson worked to notify all of the negative negative cases or negative team members, and so it was a pretty robust response to doing that, we were really able to successfully do all that testing because we work so closely with Providence St. Mary Medical Center annually to do an annual flu shot drive-through clinic, and we do Ebola planning with them and things like that. And so we already have a really strong partnership with our partners there at Providence, and we're used to coordinating with them on logistics for public health preparedness and things like this. And so if you go to the next slide, please, Chelsea. And so you'll see that, we had several cases or individuals who had already been tested through their healthcare providers. And so in total, of the 1,400 or so team members there at Tyson, 276 people had tested positive for COVID-19. And this shows a disease prevalence rate or disease activity rate of about 20% there on site, which at other sites like Boeing, for example. This was the first meat processing facility outbreak in Washington state, at least, but there was an outbreak at Boeing early on in COVID-19, and we were talking to the state, and they were saying, you know, we chose to close when they had about 10% disease prevalence amongst their workers, and that was kind of our magic line there, was if we were going to get to 140 cases, which we were getting really close before we did the outbreak testing or facility-wide testing. And so that's where we went, and we found that, you know, 276 individual team members had contracted the disease. And since, from what I understand from Benton Franklin County, is that 3 of those cases have since passed away due to COVID-19 related complications. You know, we really, I think all parts of this were really difficult as we moved through to try to figure out what was going on at Tyson. I know a lot of the pressure that we were getting to be really heavy-handed with Tyson was really far outside of our scope within public health and communicable disease and COVID-19 management. A lot of it was more along the lines of social equity and workplace and worker rights, and so we tried to kind of stay in our lane there, which is also really hard because in public health, you know, health equity and social equity are completely part of our charge as well. But with this, you know, we really tried to stay within our lane and do what our public health role was, and I really appreciate Dr. Yaka helping to lead that charge in Benton Franklin Health District, because it was very politically charged, as I'm sure all of you know. And as we move through, you know, with now Tyson has reopened, but Chelsea, if you go to the next slide, we can review kind of what they have in place now. And so Tyson actually, my next slide says when they reopened, but they reopened on May 5th, and we worked with them, and that was really an operational decision of Tyson. It wasn't, we didn't say when they could reopen or not. What we did is we looked with Tyson at how many team members could return to work and when, and how that would work for their operations, and what things they were going to have in place, what prevention measures they were going to have in place when workers began to come back. And so, you know, during the closure, they were doing deep cleaning and sanitation, and then they also hired a medical team, which is like a remote kind of traveling medical team that's there. From what I understand, on site and accessible to team members to do, you know, screening for daily clinical symptoms. There's a nurse practitioner there, and they're used to do kind of enhanced education in the, and then working with a language line to provide that education in a culturally linguistic appropriate language. There's over 11 languages spoken there at Tyson, and so that was definitely a challenge in this as well. And then Tyson also put in place you know, some other, you know, to meet CDC and OSHA guidelines, which are in line with what we were requiring them to do, or are requiring them to do, as with Washington State Department of Labor and Industries. You know, they're doing symptom and temperature checks every day for all team members before their shift and entering the building. They're providing all the mandatory face masks to all team members, and they have enhanced their social distancing measures that they have in place. Or physical distancing measures that they have in place there. An area where we saw more cases than in other areas was actually on their harvest floor. And so with that, they actually have all of their team members there wearing not only a mask, but also a full plastic like face shield. It's pretty much like in the healthcare setting, it almost looks like a papper hood. And so to reduce any droplet transmission between workers, and that's also required of any USDA inspectors who are on site as well, because we did test all of them, and there was one case that came out of a USDA inspector. And so, Chelsea, if you go to the next slide. Tyson did reopen on May 5th, and so employees who tested negative were able to return to work immediately. And any positive employees or team members were able to return to work after they were 7 days, after 7 days and 72 hours symptom-free. Sorry, my bullet point's a little off there. And so 7 days from symptom onset, several of them were asymptomatic though, and so it was actually 7 days from when they were tested. And so opening, being tested, most of them were tested on the 24th, and then opening on May 5th, they had plenty of time to return to work with that. And so that's the bulk of my presentation. And of course, I'm happy to answer any questions or wait until later, because I think we have another speaker who will be speaking about agricultural workers as well.
Thank you, Megan. That was very well done, and you definitely have been doing a lot. So very instructive, and I hope that this might serve a bit as a model for other processing plants in agriculture around the state. And that's one of the reasons we wanted to hear this case study. Dr. Yeka, we've asked you to perhaps comment on what you just heard from Megan, as well as comment on what you think the lay of the land is in the counties that either you live in or that you represent professionally in terms of getting to phase 2. So have you been able to give that any thought?
Yes. Wes really gave us some good data for the background of this, and really the readiness for phase 2 in the Greater Columbia. And we have such a variation. You saw on the charts, we have some of the lowest rates in the state to the highest rate in the state. So in our counties, so really diversity. What the governor looks for, he uses a risk assessment dashboard, and it's present in the guidance in the state. And he looks at 5 different dashboard disease activity. I'm not going to go into that because Wes covered that pretty well, but it's low in following in all the counties except for Yakima, as we know. The other thing with that is COVID-like illness. These are illnesses that are monitored throughout the state, and with coughing, symptom like COVID-like, and those are really falling well. So disease activity is going down. That's good. Testing capacity. We're getting better in that all the time. It's slightly improved this week, and we are being able to do more tests, and material and labs are available. Case and contact tracing. This is what, and there was a question about, well, what happens if you have an increase after you go into the different phases? Well, this is why they want you to have a robust case and contact tracing, because we think this is one way, if you loosen things, that you can keep disease down in your community. So anyone that's going in for phase 2, as we'll see later, has to have a robust case and contact tracing. The state is also bringing in a lot of National Guard, and so those counties that have problems with case and contract, they can use the state for this. Risk to vulnerable populations, as you know, the long-term facilities where our real vulnerable population was, and that's where a lot of the major cases were, and deaths in the elderly. And they are improving a lot more of the testing of that. I think they've done a lot in those areas. So we're seeing improvement all the time in that area. Then he looks at the healthcare system readiness, and that's the hospital beds, ICU units, ventilators, state PPE, and this looks really robust right now. We have lots of capability throughout our community. They've just opened up elective surgery. That might affect it some, but everyone's has a really pretty good handle, I think, on that type of thing. So these are the 5 things that the governor's kind of looking for as we go from one phase to the other. And again, Greater Columbia, we have such a diversity in our counties, from Columbia, we had 1 case, and that was really early, and it was an imported case from outside the United States. So going into, speaking of that, then how do you get into phase 2? Wes showed the kind of chart. What you need is the health officer asking the county and the counties to come on board, and then you have to present all these things that we're kind of in those dashboards. You know, we have to have low infectivity. We have to have case investigation. We have to have isolation, quarantine. We have to have this hospital sign on board and everything. And the first county in Greater Columbia to apply for that was Columbia County, and we went through that process and was approved, and we've been in that about 2 weeks now. And Martha Lanham, do you have anything to comment on that? How things are going?
Yes, thank you, Dr. Yaka. I can answer a couple things about the phase 2. Phase 2 is going really well. Tomorrow will be 14 days of our 21 days in. So with a little luck next week, we fully expect to go for an application to move to phase 3 next weekend or the following Monday. Not this weekend, next weekend. At our we're 13 days today. Challenges of going to phase 2 was people coming into our community. We in Columbia County, we kind of made the port and the chamber and the public health and the city all got together and had a little sent out a little motto that we would do Columbia County first, so that when our hairdressers started back up, they started back up with existing clients. When our golf carts started back up the first week, they only took members, local members, until we could kind of get the guidelines all figured out and make sure that we had everything in order. In Garfield County, when they opened up, the concern that what was unexpected, I guess, over there when we moved to phase 2 was all the campers that came in. So while we moved to phase 2 and everybody else was still in phase 1 and supposed to stay home, we got the first weekend we got a big influx into our national forest and our on the edge of Garfield County with a lot of campers, and that was a little bit of concern. Again, the people moving around a little bit more in phase 2 is what you're concerned with, but we haven't had any positive tests in Garfield County with this being at 13 days, so that's a good thing. I can't answer the question that was earlier about what do you do if you go to phase 2 and then you get a bunch of outbreaks. Basically, a bunch of cases. Basically, it has to be classified as, if it's just a bunch of cases that are not connected, then I have a conversation, the health department director has a conversation with Dr. Wiesman and decide if it's individual cases, maybe cases coming from outside the county, or is this an outbreak within our community that we didn't have before? And then that decision would then be made by Dr. Wiesman of how they handled that, whether you went back to phase 1 because we needed to at that time, or we would stay at phase 2 longer or whatever. So it's not an automatic, it's a conversation of kind of where the outbreak came from to know what the next steps are. So hopefully that answered that question.
Good. Thank you, Martha. The other Walla Walla, now we are in the process, or Megan's in the process. In fact, she has, I think, completed that process of going into phase 2. As you saw, we didn't quite meet the activity level or cases, but that's going down drastically now, and we're very close. And about the only positives we're having now is when we're doing mass testing and of asymptomatics. So. Megan, do you want to say a few words on that?
Yeah, I think that, Walla Walla County is working on our variants. I plan to submit it to Secretary Weissman today. And, I think it's, all about, and I think Wes said this in the beginning, investment in public health. If we have the right amount of funding and the right amount of investment in staffing and training, which here in Walla Walla we've got the an amazing team to do the case investigations and contact notification and epidemiological capacity to track data and everything else, and have an amazing partnership with Providence St. Mary. That we can handle it. And it's kind of about, we have the capability. It's kind of about that capacity, and we've been lucky that our commissioners have noticed that we need some increased capacity, and so have been able to add people to our team members, 2 nurses and some disease investigators to our team. And so we're pretty confident that even though we don't meet the crude rates of disease activity right now, if we can continue on a good trajectory by Sunday, we will meet that criteria, and we'll hopefully have that Secretary Weissman will consider our application once we meet that criteria on Sunday and move forward. And we have, I think a big piece of this is helping our businesses succeed regardless of when we open. And so we actually have a town hall with businesses scheduled at 11 o'clock today in partnership with the Chamber of Commerce to really go over what all those reopening guidelines are for all the different sectors, because even though they're black and white, there's a lot of gray in there too. And so our goal is just to help businesses reopen safely so that we can keep our community healthy.
Thank you. With that, there's a lot of challenges. Like in the Greater Columbia, we have such a variety of situations, and we are right next door to each other, and it's difficulty. But with this, like I've never seen before, it affects the poor and vulnerable even more, and social determinants of health. So if we get too far one way, then we're hurting the social determinants of health. And I think that is going to really impact us in the future. And that's where we're going to have to really look at how when we start recovering from this is really how do we protect that poor and vulnerable population. So time crunch, so I'm going to get off. Thank you.
Thank you, Dr. Yeka. Yeah, we are running a bit late, and I appreciate wrapping up here. And hopefully we'll have time for the panel discussion at the end of the hour. I'd now like to move on to Roman Pinel, United Farm Workers, and we've asked Roman to talk about the working conditions in production agriculture and how they could be improved. Much like we've heard how Tyson's has been able to improve its processing of meat. So Roman, the floor is yours. I just want to remind everybody we've got 45 minutes left in the meeting, and we've got to get through 3 presenters. So if you wouldn't mind sticking to the schedule.
Point received. I'd like to first start by thanking Dr. Jeka and everyone who's involved in the public service of protecting our essential workers and all of the members of our community's health. Thank you very much for your tireless work. Please see in us a partner in protecting, as Dr. Jeka said, the most vulnerable and everyone in our community. Food workers and farm workers today, it really reminds me of the book that we all read in high school, Charles Dickens, when he said it's the best of times and it's the worst of times. And unfortunately, the latter is a little bit too more common for farm workers and food workers. Certainly, and I'd really like to just mention the names of the 3 individuals who passed away at Tyson due to COVID-19: Guadalupe Olivera, Jorge Castañeda, and Bernardo Torralba. These folks, we believe, suffered a preventable tragedy. And as we begin to examine, looking backwards and of course looking forward, we really are at a nexus, at a crossroads of trying to understand what the best way is what the best possible ways we can develop here to protect what really are essential workers. We all can imagine or understand and appreciate that in our country, there has never been a moment where agriculture has been produced by U.S. citizens. It's been immigrants, from the plantation South history to the Chinese workers in the early 1900s to largely Latino immigrants today. Many waves of those immigrants have been undocumented, including the vast majority of the current wave. And so we can all appreciate the fear that essential workers find themselves living in regards to being strangers in a strange land, certainly both in ag work and most food work. Additionally, particularly in the farm worker area, there's also been a history of exclusion in terms of legal rights and standards. So federally, farm workers have been excluded from organizing labor rights. They've been excluded from overtime protections and rights. And then state by state, if you examine protections like workers' compensation when injuries occur, or unemployment, that's a patchwork of benefits that exist state by state. And so when you add in the fear that immigrants have being in this country in these dynamic workplaces, and on top of that, the patchwork of protections that exist state by state at the federal level, we definitely have a significant challenge, as we acknowledge very verbally and in the news and in regulations, that they are essential workers. We need them. We need them. Otherwise, our food supply is at risk. Reverting back to the Charles Dickens quote, on the best of times side of the ledger, and we wish it was expanded to many, many more, we're very proud to point to certain places. For example, there in the Greater Columbia area, there's a farm called Chateau Ste. Michelle, the biggest winery there in Washington State. And those workers were able to organize a union, a collective bargaining agreement, and have ushered in some of the benefits that their counterparts at other facilities have been excluded from. So farm workers at Chateau Ste. Michelle have overtime after 50 hours. They've got up to 5 weeks of paid vacation, 14 paid holidays. The workers were able to convince their employer to voluntarily offer the protections of the Family First Coronavirus Act, which extends paid sick leave should someone have the need due to a COVID experience. And most importantly, throughout the over 20-year relationship the workers have had there, they've developed a respectful and trustful relationship that goes beyond just traditional worker education models. These are workers that are truly engaged with the farm owners and management in a very necessary way. And I'd like to point to one clear example. So when the workers and the management and the right people were coming together early in April to usher in extra protections for the workforce there, they came to the portable bathroom unit. And they were talking about, how much more sanitation should be provided to these workers, to the facilities there. And it came down to a very clear moment where, of course, the workers were saying they should be cleaned a lot more often, and management was considering costs, which we all can appreciate. And it finally came down to the point where Adelaida Mendoza, one of the workers who lives there in Yakima County, said, "Well, would you use that restroom after 2 hours of use?" And that was such a convincing moment that the company, of course, said, of course I would not use that restroom, and we will usher in the enhanced sanitations that makes the most sense for these workers. Now, while we wish that was those kinds of environments existed across the board, they unfortunately don't. And so our organization, while we seek to have very specific impacts like the one I just mentioned and others at places like Chateau Ste. Michelle, we often resort to other types of advocacy work, including our recent lawsuit filed there at the state of Washington, seeking enhanced protections because we recognize that farm workers, food workers, they not only work in close proximity, but they travel to work in close quarters, sometimes vans or buses. They live together in close quarters. And so the probability as the virus, I forget the gentleman's name who showed Yakima County and the red line above all, as that continues in that unfortunate path, we're also in a point now on the calendar where the season is starting up. And so harvests are going to start ramping up. Employment is going to start ramping up, and more workers are going to be living in their houses. More workers are going to be traveling in tight quarters and working side by side in vulnerable situations. And so we seek some enhanced regulations and ideally going above and beyond some recommendations and guidelines coming from the state to protect some of the most vulnerable workers there. I'd just like to close there and so y'all can imagine the grapevine within farm worker communities is probably better than texting or social media. Farm workers, food workers, they're neighbors, they're families, they come from the same towns in their sending countries, and so there's a solidarity and network that is very special. And so it didn't take long before Chateau Ste. Michelle workers were asking us to reach out to Tyson workers or to putting us in touch with some of the workers there. And so in some of our outreach work there, we are very alarmed with what we've heard and what we are continuing to hear. If I could just focus just on one of the most biggest needs that workers have been expressing to us is that there's just an unreliable flow of information. And I don't mean that to be critical of any of our servants or public servants in the health community, but for whatever reason, that is just a tangled mess of oftentimes inaccurate information, sometimes spread from worker to workers, but oftentimes, sometimes management, for example, from the Tyson facility is involved in spreading that misinformation or just in one way or another not providing access. So that has been a need that we've been trying to put our arms around, and I cite that because it's a challenge. And Megan, Dr. GCACH, if that's an area that we could be helpful, certainly our essential workers at Tyson deserve to have the most accurate information. And I would highlight that as a potential area where we can work together moving forward. Some of the other areas where Tyson workers have demonstrated some very interesting concern is, for example, we just heard yesterday that the company has announced that they will no longer provide masks for workers, that is now going to be something that workers on their own have to provide. There's also alarming concern about the hazard pay, their appreciation bonus pay, and there's concern that because it's not an hourly incentive increase, it's a bonus that's structured around attendance and performing a certain amount of days of work. And so as one gets closer to qualifying for that bonus towards the end of the period, month or a couple months, if I recall correctly, there's concern that there may be some Tylenol or some kind of medication taken to relieve symptoms like fever and those types of things, right? So that was an area of concern. And I just want to close with this one last item. worker was sharing with me how hurt he was. He's on the line right now. He'll get off work at 2 o'clock this afternoon. And his name is Trini. He's been, participating in some media interviews on his own in the local press. And in tears, he shared with me that although he did not know Bernardo Torralba, one of the workers who died, he was universally known in the plant by his nickname. And he had the very specific job of somehow marking the cattle with paint. So his nickname was El Señor que pinta vacas, the gentleman who paints the cows. And he noted that he didn't know his name, that he was thankful now that he knows his name, because his job was posted, was posted on the job board, and for other people to apply for. And so I just wanted to close with that. And of course, if there's any questions, I'm happy to answer. Thank you.
Thank you, Roman. Yeah, lots of human drama, tragedy that people are experiencing, and it's good for you to honor them. Let's hold any questions we have for Roman, if you don't mind. Roman, there is a question for you in the chat box. You might want to check that out. And move on to Allison. Allison, are you there? Allison Polson? Allison, are you there? You are.
Hello
so
there.
We just want to hear something about.
Me and my rural.
What's that?
I said me and my rural internet. I'm gonna hold. It holds out for
okay.
my comments here.
Yeah, you may need just go to audio and quit the video, but. You got about 10-15 minutes if you want to take that much, but we'd love to hear your perspective on is it the Stay Safe Stay? What's the name of the group you're in?
Yes, so the governor has 3 advisory groups that are called the Safe Start Advisory groups, and I'm happy to give a quick overview of the work, specifically the one that I am involved in. And then I certainly don't have 10 minutes of presentation, because I think most of what I'm interested in is what Greater Columbia ACH partners would like to make sure gets carried forward so that Eastern Washington has a great voice in those discussions. But I'll start with just a quick overview. There are 3 advisory groups that are comprised of folks from all over the state. The first is the Safe Work and Economic Recovery Group. They are charged with helping the governor develop his economic recovery plan, and then providing guidance for maintaining health standards, really as it relates to the economic recovery work. The second group is the Social Supports Group, and they'll be advising the governor on increasing the services that are needed, the social services that are needed, specifically with a focus around food security, safe shelter, and housing. And then the third group is the Public Health and Healthcare System Advisory Group, and that is the one that I've been appointed to. At this point, our charge is really looking at the broadening of testing efforts, preparing for a second wave, and then we spent a lot of time in this first meeting talking about PPE and distribution, and then we expect, sort of fingers crossed, to talk about how we will most equitably distribute vaccines when they become available. I have been really impressed with the group of folks that are on the Public Health and Healthcare Advisory Group. In our first 2 meetings, we spent a little bit of time just providing some broad perspective on what we see as most pressing needs as it relates to this particular area. And there was a real consistent message around equity and ensuring that we were really paying attention to our most vulnerable populations. I think the governor was actually on our call this week and really took to heart the stories that were shared by Carlos Olivares from Yakima Valley Farm Workers, and you could see sort of some movement building around how we really are looking at some of our most vulnerable populations. We've also really highlighted the likely surge of behavioral health needs this fall. I'm sure many of you have seen the Department of Health's reports that are predicting a really significant surge in both behavioral health needs, but also it could result in suicides, some projections in that way. And so I know this is not new news to the Greater Columbia ACH, but our behavioral health system was taxed before COVID came on the scene, and the idea that you would see an even greater surge this fall, I think, has a lot of us really concerned. The other area that I would highlight, we spent a lot of time in this week's conversation around PPE, and I thought that there was some really interesting comments from the governor in terms of some of the manufacturing companies in Washington that he is independently trying to negotiate deals with, since from his perspective, that the federal government has not done enough to ramp up PPE distribution. And so we spent some time talking about what equitable distribution looked like. And I think there was good support around the state trying to really marshal PPE purchasing, with a bit of the caveat that enough communication was being shared across healthcare providers of how to access it and what was available. I had shared that in our region, about a month, I don't know, gosh, time warp there, I think probably more like 2 months ago, there was some early PPE distributions that were based on a particular form that health systems needed to complete. And we had 2 or 3 health systems in our region that it was not clear to them that by not completing that, you weren't able to access some of the statewide PPE sources. So really trying to make sure that if we are going to go with the centralized effort in distribution of PPE and purchasing, that both large and small Western Washington and Eastern Washington healthcare providers can access that. The governor also talked about his efforts to negotiate some additional testing capacity, mostly on the supply side of things, not so much on the reading of the test, but really making sure that the supplies were sufficient. So I think that's what I've got so far. I would just add that the governor was highly engaged in our discussion. This was not just a staff-led set of efforts, but he asked a lot of questions and was really in a rolled up his sleeves. Let's see if we can figure this out. So that felt encouraging to me. So I will turn it back. I'll turn it back over, and I would be really interested when we get to the question area if anyone has any specific comments of needs of Greater Columbia in those key areas.
Thank you so much, Allison. That was helpful, and it's good to know that there are those folks who are engaged in thinking beyond the immediate horizon, because that horizon will be upon us sooner than we think. I'm sorry, had my microphone muted. Thank you so much, Allison. And John Roach, welcome to your part of the meeting right now. And as I think you know, we've asked you to comment on what you think the the consumer, in particular the consumer in the Benton Franklin area, is feeling about the reopening and their level of confidence in not contracting COVID-19 as they perhaps gingerly step out into a changed world. So if you wouldn't mind taking it over, and again, we're going to just ask you to keep it as brief as possible so we can have a little bit of time at the end for some Q&A. So John, take it away.
Sure. Let's see. Can you hear me? Can you see me?
Yes, we can.
But now I can't see my slides. Here we go. All right, let's try that. So thank you. And yeah, I will try to move through this as quickly as I can. I do just want to take a moment and in reference to Ramon's earlier honoring of the 3 human beings who lost their lives related to the Tyson outbreak. And, you know, it's hard to mourn people in this time. And I think we need to be intentional about it. This number will continue to grow. I can tell you that one of those 77 in the Tri-Cities, Riskia, is a friend of ours who was a family member of one of the Tyson workers who died a few weeks ago and who we attended a drive-in funeral for, or a drive-in memorial service, which was a surreal moment in the midst of many surreal moments in this time. And so thank you, Ramon. And I will also just acknowledge that one of the greatest data modelers working, Yuyang Gu, who's one of the ones who Governor Inslee uses to support his efforts, has demonstrated that, you know, had we waited for 1 additional week before we began the shutdown measures nationwide back in early March, we would have somewhere around 160,000 more deaths than the 92,000 or so that we have today. And so, you know, this sacrifice that we've all made over the last 10 weeks or so has been huge, but it has been, you know, worth it when I think when taken in conjunction with a statistic like that. So I just want to run through a quick overview of where we started and where we are to sort of set the stage for where we might be going or where we could be going. And I'm going to move through this very quickly, but I think that it's important to understand the psychological and sociological factors that are at work here that influence consumer and community behaviors in a circumstance like this. So, you know, 10 weeks ago, we in America started taking seriously the arrival of this silent virus. It spread asymptomatically, and it was projected in, you know, various estimates to have the potential to kill millions of Americans. And the responses to that initiated what is now recognized as the fastest economic contraction in history. And it really, I mean, it just seemed to happen over a period of weeks, you know, and alongside all of the fears and concerns and uncertainty that an event like that brings about, there was also a corresponding elevation in the sense of community amongst both the US as a whole and at the individual community level. And that manifested in a lot of ways. I can tell you that Accenture, the Big Four consulting firm, has done some big surveys that have shown that more than 80% of consumers feel more connected to their community in this time than they did before. I've seen that manifested locally through the Facebook groups that we've founded with people helping people, volunteering, giving money, directly supporting people to pick up groceries, to pick up prescriptions, to do the things that they can't do for themselves in this period of time. And it's been really beautiful. So there's been a lot of best of times in the midst of those worst of times, to borrow Ramon's metaphor. There was also, you know, in those early days, the prospect of some really meaningful and huge magnitude government intervention as the initial stimulus packages were being debated at the federal level. And, you know, there was a lot of hope that there could be action taken there that would really backstop the communities and the small businesses and the workers in a way that might alleviate some of the pressure that was inevitably going to be felt in terms of the economic impacts of this thing. So where we are today, well, there's been a lot of great discussion in the last hour and a half about different aspects of where we are. Obviously, we have the greatest levels of unemployment now since the Great Depression, and it happened much faster than the Great Depression did. I would argue that from a cultural, societal perspective, one of the reasons why we're feeling some of the degree of pressure that we're feeling is because the stimulus and the federal response has been, it's been somewhat inadequate in terms of being equitably distributed and made in a way that backstops some of the key areas that needed it. We also have other examples from other Western democracies that, where the percentage of GDP that, the United States is deploying for those safety net measures are, 2 to 3 times smaller than some of the other Western democracies. And, they're being deployed in a way that doesn't protect jobs in the same way as some of these other Western democracies. And so there's, both the pain that's being felt here, as well as examples from around the world of ways that things are being done differently. And I think that those things contribute to what we're now seeing as some of the polarization of the populace in terms of the ongoing response, where there's a lot of, push to reopen, and there are protests. And while I do think that's, and I'll share some statistics here in a minute that back this up, but while I do think that some of those, that polarization is kind of overblown from a media clickbait perspective, I do think that there is some underlying reality to it as well. All of this has, been compounded by disparities in access to healthcare, where communities of color, or the fact that most of our health insurance delivery or healthcare delivery is tied to insurance that comes from an employer in this country, has not had time to catch up to how fast this thing has come upon us. And we have ongoing attacks on, the Affordable Care Act. We have disparate access to Medicaid services state by state. So there's been a real challenge in providing healthcare access across the population. And that existing reality has been further compounded by what I would characterize as a somewhat weak federal level response from a healthcare infrastructure perspective. And so that, means that state by state, we don't have the same level of access to testing. I mean, some people have highlighted the fact that it's gone up. Healthcare or coronavirus testing is increasing, but we're still nowhere near the levels anywhere in the country to be able to meet even the president's own reopening guidelines that were first issued about a month ago. And of course, we now have states that are opening or beginning to open in spite of that, but it doesn't mean that they're not there. We also continue to have massive PPE shortages nationwide.
Have we lost John, Chelsea?
We may have. John, uh-oh. It looks, he's still on the phone. Hey, John, we can't hear you. If you can hear us.
Can somebody send him a text or a email real quickly?
I'll message him on here, and I'll email him.
Well,
Looks like he walked on. I'm going to email him now. I don't know if we want to.
well, let's while you're doing that, let me just throw open the floor to questions that people may have had of any of the 5 preceding speakers about anything they said. So are there questions out there for Greg Lane, Megan, if she's still on the line? She may not be on the line since she had a meeting, but Dr. Yeka, Allison, any questions? Oh, you are there. Hi, Megan.
I just unmuted everybody, so.
Okay.
This is Dan Ferguson. Oh, we have music going. Hello?
Let me get that. Oh, okay. I fixed it.
Okay, Dan, go ahead.
So great presentations, great panel discussion. Love it all. I have a question, and this could go to either Allison or Megan or John. I think it was John at the end there, regarding kind of one of the things that he referenced in regards to is the public health system resourced enough to engage in what I would call mitigation strategies around kind of the negative press of government overreach? Or I guess another way of saying it, is there significant resources to engage in collaborative conversations about safely opening up with the local business communities?
Hi, Dan, this is Megan. I would say I think that that's pretty dependent on each local health jurisdiction and their relationship and capacity within the community. You know, it's so much of our work in public health, as with, you know, I mean, all the work that we do is based on relationships and collaboration. And I can say here in Walla Walla, I know that we have a webinar or a town hall forum going right now with our local Chamber of Commerce, and we have another one, I think, at 1 o'clock and then at 4 o'clock today, you know, to engage local businesses in conversation. And I think it's just really dependent on each local health jurisdiction. And I think here in Walla Walla, we're pretty well poised because we're kind of a perfect size. We have really good partnerships. I think that, you know, everybody's trying throughout the state, but I think a lot of it also, like what you said, kind of depends on the local politics as well, which right now are really convoluted in a lot of places, I know. So I think it just really depends on each like county in a sense.
Okay, I think that's a view from Walla Walla. Is there a view from another county about the relationship between public health and the business community, in particular about reopening?
This is Lori Matson, and we're working. There's a group of us, TriDec, Visit Tri-Cities, the Chamber, and other business groups are working with our local health district as well on reopening. I don't know about addressing the specific question about the government overreach, but we are in talks and working on distributing and marketing guidelines for safe reopening. And this information should be available next week.
So, Lori, is part of the challenge that maybe Dan posed, is it one of communication to a large group of employers that are largely small businesses?
Yeah, so maybe I just I want to make sure I understand his question again. I thought the question was more around are groups prepared to deal with the concerns of business owners that feel that there's been too much government overreach. And you know, I guess speaking on behalf of our group, we're trying not to get in the political fray of all of this and just working with the health district to who has created the guidelines for Benton and Franklin County there. And I'm sure there's people on the phone from there, but they've done a wonderful job, you know, but they have limited staff, and they also, you know, don't have a marketing and communications department. So our 3 organizations, as well as other business organizations, are going to really help carry that water and make sure that businesses get the information that they need so that they can comply with the guidelines and can open safely, so they're comfortable bringing their employees back, and also to help restore consumer confidence so that consumers feel comfortable knowing everything from signage to you know, getting the proper PPE and all those various components.
Great, thank you. Thank you for sharing that information about the Tri-Cities. That was Lori Madsen from the Tri-Cities Chamber of Commerce. Anybody from Yakima or another county want to weigh in about that relationship between the business community and the public health needs? Okay.
This is Dan Ferguson. So I had invited Jonathan Smith to this meeting. He had to leave at 10 o'clock, which I'm really sorry about. He works with the Yakima County Development Association. And I had a previous conversation with him around what the role of our current health district is in working with industry. And similar to what's already been described, although we're not at the point yet where Walla Walla is at in terms of having the town halls and really engaging in those kind of collaborative conversations around opening up. It's very much focused on occupational safety and regulatory, which I think is fairly traditional with public health, but it's not yet reached to the point of, again, gaining kind of that mutual benefit, collective impact, collaborative conversation. So I'm thrilled to hear it's going on in Walla Walla.
Okay, thank you, Dan. Any other quick comments to this particular thread of questions?
This is Kevin Martin in Kittitas. One thing I heard in the original question was, is public health resourced to be able to do the outreach and messaging? And it's probably worth calling out to the folks who don't swim in healthcare waters that public health statewide has been eroded for years, to the point that most public health departments don't offer any direct healthcare services where they might have used to offer vaccinations. Here in Kittitas, the only real direct outreach is a needle exchange program and working with the Kittitas County Health Network.
Okay, yes, you're absolutely right. You're absolutely right about that. We track on some of the indicators work we do, just the funding for public health, and it's been a long slide. Okay, I see John is back. John, we've got about 5 minutes. If you want to finish your presentation, could you go ahead and sort of through what you have in 5 minutes?
Sure. Can you hear me?
We can hear you.
Okay. Yeah, I'm really sorry. I don't know what happened. My computer just froze. So I think I'll go ahead and, can you see my screen?
Yes, we can.
All right. I'm just going to cut to the chase here. I think that the main point that I wanted to make here is that the public health and economic health are inextricably connected. And we, you know, with the push to reopen and the idea that reopening is some binary where we're going to hit the reopen button and things are going to go back to some version of normal. I think framing the conversation that way is a real problem, and I don't think most of the people on this call have that type of either or thinking, but it's prevalent in the way that the discussion is framed in lots of places, and I think it will create problems as we set expectations for what the economic recovery aspect of this looks like. The graph up on the screen is Open Table, which is a reservation app that's nationwide that for restaurants. And what it demonstrates is that the reduction in traffic to restaurants around the country, and in particular in the 3 cities on the West Coast, or 2 cities on the West Coast and in New York that were first impacted by the virus, that the drop-off that you see there that started on March 8th happened before there were any shutdown orders in place. It preceded the government intervention that said that you're not allowed to go to restaurants. And it was driven by public fear and concern about what this virus might mean, fears and concerns that are now confirmed in terms of the virus's severity, and even along with it, new understanding and awareness of different aspects of the virus's severity. So if you pair that with this graph, which also comes from Open Table data, and this illustrates the same restaurant traffic in 3 states that were earliest in starting their reopening: Tennessee, Texas, and Georgia. And as you can see, they were about 10 days later, starting on the 18th of March, than the West Coast of really hitting bottom. But as they started to open, and granted in a couple cases here, there's reduced capacity, so it's very similar to Washington's phase 2 guidelines. It wasn't a massive onrush of traffic back into restaurants. It was a very slow trickle of people being willing to come back and engage in that kind of experience. And this real data is very consistent with the results of this poll, which I'm not going to go through in detail with the time that we have, but this is from a Ipsos and CBS News poll, but it mirrors what a half dozen other recent polls have demonstrated, which is that the vast majority of Americans are not willing to undertake many of these types of economically important activities unless they feel that, from a public health perspective, that their own safety and the safety of their community is something that they can be confident in. And I should say too that the cross-section of this poll was broadly Republican and Democrat. This is not this is not really a partisan issue, despite the frequent framing of it in that way in the last 4 to 8 weeks. So I think I'm happy to share these slides with anybody on the call if they're not going to be sent back out. But I think that the big takeaway for me is that at the community level, here at the Tri-Cities level, we need to be undertaking our economic recovery with an understanding that we cannot get to where we need to be without the public health that encompasses our entire community and that recognizes the disparities that I was talking about before as being intrinsic to a true recovery. And so I'll just close. I don't have enough time to go into it, but the last 2 slides here were really about challenging the idea that we are trying to go back to normal, and instead recognizing that these types of societal inflection points, much like the plague led to enabling the Renaissance, 450 years ago, these types of cataclysmic societal impacts create opportunities for us to think about ways not just to return to normal, but to evolve new systems that are more equitable and that create a kind of sustainable economic recovery that we can all be proud of. So I'll leave it at that. And once again, I apologize for my technical difficulties.
John, nothing to apologize. We've all been struggling with all sorts of gremlins and glitches in our new virtual lives. We are about out of time, and I just want to confirm with the ACH staff that all these presentations will be posted to the website. Is that true?
Yes.
Yes, that's correct.
Great. So look for these in a day or two. Is that right, Lauren?
Yep, we can have it up by the end of the day.
Okay, wonderful. Are there any last minute questions of any of the presenters who are on the call still? Yeah, I thought that might be the case. It's a 2.5-hour meeting. That's a long meeting, at least for me, in a Zoom setting. I definitely want to thank all our presenters for the time you put into preparing for this. I think we all learned a lot. I certainly did. And we will be back in a month with a set of topics to be determined. But there's lots to learn. And it's my hope that over the intervening 4 weeks, we will be able to see phase 2 embraced by every county in our region, and that means both a win for public safety, public health, disease control, as well as keeping people somewhat employed. With that, this is Patrick just signing off, and thank you once again. And we will all be in touch, if not before, on June 18th. Take care.
Thanks, Patrick.
Thank you.
Thank you.